Hello, my name is Rocio. I'm doing this for my biology class. I'm going to be talking to you today about pregnancy, STD tests, and birth control. Um, so I'll start off with pregnancy. So when you're pregnant, it is very important that you get care early on. So when you are pregnant for 40 weeks. These 40 weeks are broken down to 3 trimesters, and in each trimester there is important tests that you need to get done timely, and there is a time frame to each test just to make sure that the pregnancy is healthy, along with the mother as well as the baby. So I'll jump right into each trimester. So in the first trimester, it's broken down from 0 to 12 weeks. We test first what's called a prenatal panel. The prenatal panel consists of hormones, the blood type of the mother that may affect the baby, and it also checks for mother's blood count. Also, in this first trimester, from 10 to 13 weeks, we check what's called an AFP test. The AFP test is a genetic test that checks the babies to see if there's any birth defects. Birth defects can happen exposure to medicine or chemicals, infections during the pregnancy, or again, it's hereditary. So it's very important that you get these tests done to make sure that you do deliver a healthy baby. Along with that test, you do an NT ultrasound. The ultrasound checks to make sure that the baby is growing the same rate as the weeks that you're supposed to be. At the second trimester, we check the second genetics test, the second AFP test. And this one checks to make sure that the first one is, it compares from the first one. So if the first one came out negative, we assure that this one is also negative. But there are instances where the first one comes out positive and the second one comes back negative, or vice versa, where the first one is negative but the second one is positive. If that happens, your provider has to send you over to a genetic test to do more studies of the baby and to just keep track of you, and make sure that when you're delivering, everything is there for you to make sure that you both are healthy. You also check an anatomy ultrasound. The anatomy ultrasound is what's commonly known as the gender reveal ultrasound. That's when you will know what the sex of the baby will be. And then you also, for the first trimester at 24 weeks, you check the 24-week labs. One of the labs is to check to make sure that your glucose level is okay. In pregnancy, it is common to have gestational diabetes, and this is just diabetes that comes up during pregnancy. And you also, at 27 weeks, you receive a shot. The shot is called the Tdap shot. It is important that you get the test for the health of your baby when it comes out. This protects the baby from what's called the whooping cough, the pertussis cough. For us, this can be a regular cough or cold. For a baby, it is known to be fatal, and also babies, they sound like they're gasping for air. So it's recommended that you, the mom, the dad, anybody that's going to be close in contact has this vaccine. At third trimester is from 29 to 40 weeks. At 35 weeks, we check a vaginal culture, to make sure that the woman's vagina doesn't have a bacteria called GBS. If you do come back positive on that test, it's a simple treatment. They'll let the hospital know that once you're there to give you IV penicillin, and that should take care of the infection. If you don't get tested for this, babies, if they're born vaginally, they get bacteria on their eyes, and they do have to stay longer periods of time in the hospital to clear up their bacteria. So again, it's very important that you get prenatal care. I know a lot of people don't go to the doctors. They just think, like, I really don't need to go. I know I'm going to be pregnant for 9 months. I know I'm going to be fine. I have no symptoms. But it is very important that you get checked to make sure that when you're actually in labor, everything is there for you and hands-on. Along with that, women that are 35 and older are considered advanced maternal age, and they also have to go to a genetic center. This genetic center is in Orange, and they will help you. They make sure they do more tests, genetics on your family, on your husband, everything to make sure that the baby is okay again. Women 35 and older are more at risk to have birth defects, something like Down syndrome, chromosomal defects, so it's very important that they go to genetic center. Another test that they do, or another thing that they give you, so if you've had premature babies in the past, they'll give you a shot called Makina. The Makina shot is given every week. It is painful. Women dread it, but this vaccine helps you keep the baby for a longer gestational period. Again, if your baby comes out premature, they can be respiratory problems. The brain is not fully developed, so it's very important to keep the bun in the oven for at least 38 weeks or more. Okay, so we'll go right on to STDs. STDs are the most common ones are syphilis, gonorrhea, chlamydia, HIV, AIDS, herpes. The list goes on. But everyone, women and men are included, these tests are free in every clinic that you go to. You can apply to a card called Family Pact. The Family Pact card takes care of birth control if you need it, and every STI testing. STDs and STIs are the same thing, sexually transmitted diseases. These diseases, some of them are very easy to cure with just one treatment of an antibiotic and just following up with your doctor within a month to make sure that the symptoms have cleared. If you have an STD, you don't want to go get checked because you don't know how much it will be, or you just don't want to know. STDs can also cause you to become sterile. For women, some women can get cervical cancer. So again, these services are always free to anybody. Again, because the government doesn't want everybody to be without resources. So just go to the clinic, get checked out. It's recommended once a year to be checked for these tests. Also, that FAMPACT card covers for pap smears. Pap smear is a test that women get done over the age of 21, and this checks to make sure that you don't have abnormal cells, and also human papillomavirus. Human papillomavirus is also a disease sexually transmitted. Men usually get genital warts. Women also get genital warts, but if women untreat it, that can develop into cervical cancer. Again, pregnancy, STD, pap smears are always free. They're government paid, so you just have to go if you're just really scared, don't want your parents to know that you want to get STDs, or you don't want to, if you want to get birth control. You can technically go to the clinic from the age 14 and up and ask for these services. They can also be confidential, so your parents will never know. On the side of birth control, there is different kinds of birth control. I have just 3 of the main IUDs available. So there's Skyla, which is for 3 years, Kylena, 3 years, Marina, 5 years, and there's also another one called Paragard, and that one's for 10 years. There's also, you can use condoms, which is one that is most everybody uses. There's birth control pills, there's a depot shot, there's patches, there's rings. So there's different kinds of method that you can use, and also treatments. Treatment is a big one for us. You just have to get treated if you believe you have something. If something doesn't feel right, go to the clinic. They'll sign you up for a Family Pact card. You don't have to pay anything, and it just helps. Again, we just have to make sure that you're healthy, everybody's healthy, and yeah, you know, if this helps, if this video helps for anybody at least, I'll be happy with that. But that will be it for my video. Thank you.